Did you know that more than 40% of Americans suffer from some form of digestive disorder, such as acid reflux, irritable bowel syndrome, or constipation? And did you know that these disorders can affect not only your physical health, but also your mental and emotional well-being? If you're one of the millions of people who struggle with digestive issues, you may be looking for natural and effective ways to improve your digestion and restore your balance. Welcome back to our channel. In this video, we'll explore some of the most popular and powerful herbal remedies for digestion, such as ginger, peppermint, and chamomile. We'll also look at the scientific evidence behind their benefits and how you can incorporate them into your diet and lifestyle. So, grab a cup of tea, sit back, and get ready to learn how you can harness the power of herbal remedies for digestive health. Number 1. Ginger. Ginger Zingiber officinale is a spicy and aromatic root that has been used for centuries in traditional medicine, especially in Asia. Ginger is well known for its anti-inflammatory, antioxidant, and antimicrobial properties, which can help protect your digestive system from various infections and diseases. Ginger can also stimulate the production of saliva, bile, and gastric juices, which can aid digestion and prevent indigestion, nausea, and vomiting. Ginger can also relax the muscles of the gastrointestinal tract, which can reduce spasms, cramps, and bloating. Ginger can also modulate the activity of the gut-brain axis, which is the communication network between your digestive system and your nervous system. This can help improve your mood, cognition, and stress response, which can also affect your digestion. Ginger can be consumed in various forms, such as fresh, dried, powdered, or candied. You can also make ginger tea by steeping some sliced or grated ginger in hot water for 10 minutes and adding some honey or lemon for extra flavor. You can drink ginger tea before or after meals or whenever you feel digestive discomfort. According to some studies, ginger can help relieve symptoms of dyspepsia, a condition characterized by upper abdominal pain, fullness, and nausea. One study found that taking 1-2 grams of ginger powder before a meal accelerated gastric emptying and reduced indigestion by 50%. Ginger can also help prevent and treat nausea and vomiting caused by various factors, such as motion sickness, pregnancy, chemotherapy, or surgery. A review of 12 studies involving 178 pregnant women found that ginger significantly reduced nausea compared to a placebo and was as effective as vitamin B6. A meta-analysis of 17 studies involving 175 patients undergoing chemotherapy found that ginger significantly reduced the severity and frequency of acute and delayed nausea and vomiting. Number 2. Peppermint. Peppermint mentha ex piprita is a refreshing and cooling herb that belongs to the mint family. Peppermint is rich in essential oils, such as menthol, menthone, and limonene, which give it its characteristic flavor and aroma. Peppermint has antispasmodic, analgesic, and carminative effects, which means it can relax the smooth muscles of the digestive tract, relieve pain, and reduce gas. Peppermint can also stimulate the secretion of digestive juices, which can improve digestion and prevent indigestion, heartburn, and acid reflux. Peppermint can also modulate the activity of the gut-brain axis, which can affect your appetite, satiety, and mood. Peppermint can be consumed in various forms, such as fresh, dried, or oil. You can also make peppermint tea by steeping some fresh or dried peppermint leaves in hot water for 10 minutes and adding some honey or lemon for extra flavor. You can drink peppermint tea before or after meals or whenever you feel digestive discomfort. According to some studies, peppermint can help relieve symptoms of irritable bowel syndrome (IBS), a common disorder that affects the large intestine and causes abdominal pain, bloating, gas, diarrhea, or constipation. A meta-analysis of 12 studies involving 835 patients with IBS found that peppermint oil capsules significantly improved abdominal pain, bloating, and stool frequency compared to a placebo. Peppermint can also help prevent and treat colonic spasms, which are involuntary contractions of the colon that can cause pain and discomfort. Number 3. Chamomile. Chamomile Matricaria chamomilla is a delicate and fragrant flower that has been used for centuries in traditional medicine, especially in Europe. Chamomile is well known for its soothing, calming, and anti-inflammatory properties, which can help relax your mind and body. Chamomile can also reduce inflammation, irritation, and ulceration in the digestive tract, which can cause pain, bleeding, and infection. Chamomile can also stimulate the production of mucus, which can protect the lining of the digestive tract from damage. Chamomile can also modulate the activity of the gut-brain axis, which can affect your sleep, stress, and anxiety, which can also affect your digestion. Chamomile can be consumed in various forms, such as fresh, dried, or oil. You can also make chamomile tea by steeping some fresh or dried chamomile flowers in hot water for 10 minutes and adding some honey or lemon for extra flavor. You can drink chamomile tea before or after meals or before bedtime to promote relaxation and digestion. According to some studies, chamomile can help relieve symptoms of gastroesophageal reflux disease GERD, a condition in which stomach acid flows back into the esophagus and causes heartburn, chest pain, and regurgitation. A study in 34 patients with GERD found that taking chamomile extract twice daily for 6 weeks significantly reduced the frequency and severity of heartburn compared to a placebo. Number 4. Fennel. Fennel Feniculum vulgare is a sweet and aromatic herb that belongs to the carrot family. Fennel is rich in volatile oils such as anethole, fenchone, and estragol, which give it its characteristic flavor and aroma. Fennel has antispasmodic, carminative, and anti-inflammatory effects, which means it can relax the smooth muscles of the digestive tract, reduce gas, and soothe inflammation. Fennel can also stimulate the secretion of digestive juices, which can improve digestion and prevent indigestion, bloating, and flatulence. Fennel can also modulate the activity of the gut-brain axis, which can affect your appetite, satiety, and mood. Fennel can be consumed in various forms, such as fresh, dried, or oil. You can also make fennel tea by steeping some fresh or dried fennel seeds in hot water for 10 minutes and adding some honey or lemon for extra flavor. You can drink fennel tea before or after meals, or whenever you feel digestive discomfort. According to some studies, fennel can help relieve symptoms of irritable bowel syndrome (IBS), a common disorder that affects the large intestine and causes abdominal pain, bloating, gas, diarrhea, or constipation. Fennel can also help prevent and treat infantile colic, which is a condition that causes excessive crying and fussiness in babies due to abdominal pain or discomfort. Number 5. Licorice. Licorice glycyrrhizaglabra is a sweet and bitter herb that has been used for centuries in traditional medicine, especially in Asia and Europe. Licorice is rich in glycyrrhizin, a compound that gives it its sweetness and anti-inflammatory properties. Licorice can also increase the production of mucus, which can protect the lining of the digestive tract from damage. Licorice can also modulate the activity of the gut-brain axis, which can affect your stress, anxiety, and depression, which can also affect your digestion. Licorice can be consumed in various forms, such as fresh, dried, or extract. You can also make licorice tea by steeping some fresh or dried licorice root in hot water for 10 minutes and adding some honey or lemon for extra flavor. You can drink licorice tea before or after meals, or whenever you feel digestive discomfort. However, you should be careful not to consume too much licorice, as it can cause side effects such as high blood pressure, low potassium levels, and fluid retention. Therefore, it is recommended to limit your intake of licorice to no more than 5 grams per day, or use deglycyrrhizinated licorice DGL, which is a form of licorice that has most of the glycyrrhizin removed. According to some studies, licorice can help relieve symptoms of gastroesophageal reflux disease GERD, a condition in which stomach acid flows back into the esophagus and causes heartburn, chest pain, and regurgitation. Licorice can also help prevent and treat gastric ulcers, which are sores in the lining of the stomach that can cause pain, bleeding, and infection. A study in 100 patients with gastric ulcers found that taking licorice extract twice daily for 6 weeks significantly accelerated ulcer healing compared to a placebo. Number 6. Turmeric. Turmeric curcuma longa is a bright yellow spice that has been used for centuries in traditional medicine, especially in India. Turmeric is rich in curcumin, a compound that gives it its color and anti-inflammatory properties. Turmeric can also stimulate the production of bile, which can aid digestion and prevent indigestion, gallstones, and liver problems. Turmeric can also modulate the activity of the gut-brain axis, which can affect your immune system, inflammation, and mood. Turmeric can be consumed in various forms, such as fresh, dried, powdered, or extract. You can also make turmeric tea by steeping some fresh or dried turmeric root in hot water for 10 minutes and adding some honey or lemon for extra flavor. You can drink turmeric tea before or after meals or whenever you feel digestive discomfort. However, you should be aware that turmeric can interact with some medications, such as blood thinners, diabetes drugs, and antacids. Therefore, you should consult your doctor before using turmeric, especially if you have any medical condition or medication. According to some studies, turmeric can help relieve symptoms of inflammatory bowel disease (IBD), a group of disorders that affect the colon and cause inflammation, ulcers, bleeding, and diarrhea. These disorders include ulcerative colitis and Crohn's disease. As you can see, herbal remedies can offer a natural and effective way to improve your digestion and enhance your digestive health. Ginger, peppermint, chamomile, fennel, licorice, and turmeric are some of the most popular and powerful herbs for digestion. However, before you start using any herbal remedy, make sure to consult your doctor, especially if you have any medical condition, allergy, or medication. Also, make sure to use high-quality and organic herbs and follow the recommended dosage and preparation methods. By doing so, you can harness the power of herbal remedies for digestive health and enjoy the benefits of a healthy and happy gut. Thank you for watching this video, and don't forget to like, share, and subscribe for more informative and inspiring content.